Hey everyone, welcome back. Today we're going to be taking a deep dive into BPH interventions. Maybe you're prepping for an appointment with your doctor, or maybe you're just curious about what happens when a prostate decides to, well, just keep growing,
It's certainly a common issue.
right? Either way, we're going to be breaking down a recent medical review article on all the ways doctors can tackle this.
It's a fascinating area, especially considering how common BPH is. By age 90, about 90% of men are dealing with it to some degree.
Wow, that's a lot of men. But
hmm
here's the thing. Not everyone with BPH has, those really noticeable symptoms, right? Like those urgent bathroom trips.
Right.
So for those who are symptomatic, what makes a doctor decide to move beyond just watchful waiting or just medication?
Well, that's a great question. BPH does start developing around age 40,
Mm.
but symptom severity often comes down to size. The larger the prostate, the more likely it is to squeeze the urethra. And that's what causes all those urinary issues.
I see.
Like, imagine trying to water your garden with a kinked hose. That's essentially what's happening.
Ah, okay. But
Mm.
with so many different intervention options out there, how do doctors even choose the right one? I mean, it's kind of overwhelming.
Yeah, it's definitely not one size fits all. Um, TRP, or transurethral resection of the prostate. That's been the gold standard for decades. Like a tiny lawnmower going in through the urethra and trimming away excess prostate tissue.
Oh, wow.
But even TURP has evolved, moving
Yeah.
from monopolar to bipolar technology.
So it's gotten even more high-tech, more efficient.
Exactly.
What's the advantage of going bipolar?
Well, it's all about reducing the risks. Monopolar TURP used a specific irrigation fluid that could sometimes lead to electrolyte imbalances. We call it TRP syndrome.
TRP syndrome.
Yeah, but bipolar TRP uses a safer fluid, so it's a much gentler approach. Plus, you get the added bonus of those TRP chips. They can be analyzed,
Yeah.
sometimes revealing hidden prostate cancer that wasn't detected before.
Oh, wow. That's a bonus for sure. You go in for one thing and you might find something even more serious.
Exactly. But for patients who aren't keen on having tissue removed, there are newer, minimally invasive options available. Things like laser treatments, steam, even tiny implants.
Okay, let's talk lasers. The article mentioned HOLEP and Greenlight PCP. Are those just different names for the same thing, or?
They both use lasers, but their mechanisms are quite different. Think of HOLEP, or holmium laser enucleation of the prostate, as a laser fiber that very precisely shells out the entire enlarged portion of the prostate. It's like removing the pit from a peach.
Very precise. What about Greenlight PVP?
Greenlight PVP, or photoselective vaporization of the prostate. It uses a different type of laser. That vaporizes the targeted prostate tissue.
Okay.
Imagine it more like a fine mist being zapped away. This one's a good option for patients on blood thinners, too, because it simultaneously cauterizes as it cuts, minimizing bleeding.
So less cutting, more vaporized.
Yeah, more control.
Got it. What about this resin procedure? It sounds more like a spa treatment than a medical intervention.
It does have a certain soothing ring to it, but instead of cucumbers and essential oils, we're talking about targeted injections of steam to shrink the prostate.
Hold on, steam. That sounds almost too simple. How does that even work?
Well, it might sound like science fiction, but it's surprisingly effective. The steam causes thermal damage to the excess prostate tissue, leading to cell death and shrinkage. And the beauty of it is, the heat stays confined to that targeted area, sparing the surrounding tissues.
Okay, that's remarkable. So we've got lasers, steam, and then there's Urolift, which is all about widening the urethra without actually removing any tissue, right?
Exactly. Urolift uses tiny implants, almost like staples, to hold back the obstructing portions of the prostate.
So no cutting, no zapping, just
Propping it open. Imagine installing tiny scaffolding to prop open the urethra and create a wider channel for urine to flow through.
That's fascinating. I can already see how this wide range of interventions might raise some questions when it comes to imaging, especially MRI.
You're absolutely right. Those Urolift implants, for example, they can create distinct artifacts on MRI. And speaking of MRI, the article hinted at its potential role in personalizing BPH treatment, which is something I'm really interested in.
That's a great segue because I was just about to ask about that. It seems like MRI could offer valuable insights beyond simply measuring prostate size. What kind of information can we get from those scans that would help guide those treatment decisions?
Well, we know that as the prostate grows, it can compress the urethra. But what if we could use MRI to pinpoint exactly where that compression is most severe? It's like having a plumbing inspection for your prostate.
Oh.
That level of detail could help target the treatment much more effectively.
So instead of a one-size-fits-all approach, it's more tailored. more personalized.
Exactly.
But how does MRI factor into choosing between all these different interventions? Like lasers versus steam versus implants?
That's where things get really interesting. Remember those BPH types we talked about earlier? Well, MRI can clearly distinguish between them.
Okay.
For example, if someone has median lobe hypertrophy, where the prostate's protruding into the bladder, certain interventions like urolift might not be as effective. Knowing this beforehand could save someone from going through an unnecessary procedure.
So MRI can really help avoid those unnecessary procedures.
Exactly.
But the article also mentioned something about zonal volume and BPH composition. How do those details play into personalized treatment?
Great question. So the prostate is divided into zones, and BPH typically arises in the transition zone, but the extent of involvement can vary, and MRI lets us measure the volume of each zone, giving us a much clearer picture of how much of the prostate is actually affected by BPH.
So it's not just about overall size, it's also about which part of the prostate is most involved.
Exactly.
What about BPH composition? What does that even mean?
That refers to the types of cells that are actually making up the BPH nodules. Some are primarily glandular, while others are more fibrous. And this composition can actually influence how the prostate responds to different treatments. For example, some medications work by shrinking the glandular component of BPH.
Ah, interesting.
So MRI can help determine if a particular medication is likely to be effective based on what those BPH nodules are made of.
It's like knowing the ingredients before you start cooking.
Exactly.
You can't just use any recipe if you want the best results.
Right.
So the more we know about the specifics of a patient's BPH, the better we can choose the most effective treatment.
Exactly.
But like any medical procedure, there are always potential complications to consider.
Of course.
We talked about bleeding being a risk with any of these interventions, but are some procedures better suited for patients who are already on blood thinners?
Absolutely. Laser treatments like green light PVP, they're particularly good options in those cases because they offer excellent coagulation, which minimizes the risk of bleeding.
Okay, good to know. But there are other complications to consider as well, like capsule perforation,
Right.
where there's a tear in the lining surrounding the prostate.
Yeah.
How is something like that detected?
It's usually detected during the procedure itself. Or through imaging, like a CT cystogram. Luckily, it's not super common, but it's something to be aware of.
Okay.
And then there's osteomyelitis, which is an infection in the pelvic bones.
Okay, now that sounds a lot more serious than a simple tear. How does that even happen? And what role does MRI play in diagnosing it?
Well, it's a rare but serious complication. That can happen when bacteria from the urinary tract enter the bones. It's often linked to perforations or fistulas that might happen during a procedure. And you're right, MRI is crucial for diagnosing osteomyelitis because it can clearly show the inflammation and infection within the bone.
So MRI is really a multifaceted tool when it comes to BPH. It's not just about measuring size. It's about really understanding the nuances of each individual case.
Precisely. It all goes back to this idea of personalized BPH treatment. We've covered a lot of ground already. From lasers and steam to implants and MRI, it's clear there's no one-size-fits-all solution. But how do we translate all of this knowledge into an informed decision for each individual patient? I mean, what questions should someone facing BPH be asking their doctor?
Those are fantastic questions, and we'll tackle those right after a quick break. Stay tuned. Welcome back. Before the break, we were talking about all the complexities of BPH and how MRI can really help personalize treatment decisions. But let's shift gears for a second, put ourselves in the patient's shoes. If you're facing BPH, what questions should you be asking your doctor when you're considering all these different interventions?
Oh, such an important point. You're right. Knowledge is power, especially when it comes to your health. One of the first things I'd ask is about the success rate of each procedure. What does success even mean in the context of BPH?
Yeah, that's a good question. Because it's not always about a complete cure, right? It's more about improving those symptoms.
Exactly. Patients should ask their doctor, what percentage of people experience symptom relief after a particular intervention? And how long do those improvements last? It's important to remember that some treatments might offer faster relief, while others might take a bit longer to see the full benefit.
Okay, so it's not necessarily a race. It's about finding what works best for you long term.
Exactly.
But let's be realistic. No medical procedure is without risks.
Right.
We talked about complications earlier, but how can patients get a realistic sense of the potential downsides?
You really need to have an open and honest conversation with your doctor about the risks of each procedure. Ask about the likelihood of complications, how severe those complications might be, and the potential long-term consequences. It's all about weighing those risks against the potential
But
benefits.
you got to make an informed choice,
Right. Exactly.
knowing what you might be signing up for. And speaking of signing up, recovery time is a big factor for a lot of people,
Oh, absolutely.
especially those with, busy lives.
Yeah.
How does that vary between the different interventions?
Well, recovery time can range from almost immediate for some interventions. You can go back to your normal activities right away to weeks or even months of downtime for others. It just depends.
Wow, that's a big range.
It is. So it's important to think about your personal and professional commitments when you're considering your options.
You got to factor in those vacation days, right?
Exactly.
One final but kind of sensitive topic is the impact on sexual function.
Right.
How can patients even approach this conversation with their doctor? And what kind of questions should they be asking?
I think it's important to just be open and honest with your doctor about any concerns you have regarding sexual function. Some interventions carry a higher risk of affecting things like ejaculation, so make sure you understand the potential impact on your sexual health before making any decisions.
So honesty and open communication are key.
Absolutely.
But with so many options to choose from, how can a patient even begin to decide which intervention is the best fit for them?
That's where that thoughtful conversation with your doctor comes in. By taking into account your symptoms, your medical history, your lifestyle, and your personal preferences, you can work together to come up with a plan that aligns with your goals.
So it's like a partnership,
Absolutely.
working together to find the best path forward. But remember, it's your health. So don't be afraid to advocate for yourself.
That's right.
Do your own research. Come prepared with questions. And don't hesitate to get a second opinion if you need to.
I agree. We've covered a lot of ground today, but we've only scratched the surface of this topic. There's a lot of information available online through reputable medical organizations. For anyone who wants to learn more,
We're just a starting point on your journey to better understanding BPH and making those informed decisions about your prostate health. We've explored the causes, the different interventions, the potential of MRI for personalized treatment, even those tough questions to ask your doctor.
Mm.
But before we wrap things up, there's one final thought I want to leave you with.
I'm intrigued.
Imagine a future where BPH interventions aren't just about treating the symptoms, but about using technology to really personalize care, predict outcomes, and minimize risks. We're already seeing this happen with imaging and minimally invasive techniques.
It's an exciting time.
It is. But of course, with any medical advancement, there are always ethical and societal considerations. How do we make sure these personalized approaches are accessible to everyone, regardless of their background or their income? And how do we navigate the potential for overtreatment or using technology in ways that don't really benefit the patient?
Those are important questions, and we need to address them as we move forward. It's not just about the science. It's also about using those advancements responsibly and ethically.
Absolutely. It's a conversation that needs to involve everyone, researchers, clinicians, policymakers, and most importantly, patients.
I completely agree. And to our listeners, remember, knowledge is power. The more you know, the better prepared you'll be to navigate all of this and advocate for your own health.
That's it for our deep dive into BPH interventions. We hope you found this episode informative and engaging. And if you're dealing with BPH yourself, we wish you all the best on your treatment journey.
Take care and stay curious.
I'm still thinking about all those future possibilities. It's really amazing to think that we could personalize BPH treatment to that degree. But let's come back to the present for a minute. If you're dealing with BPH, what's the one thing you should take away from all this information?
Well, I think the main takeaway is that BPH is highly treatable these days. We have so many options now. It's not like it used to be.
What do you mean?
Well, it used to be that men just had to accept those urinary symptoms as they got older.
Oh, I see.
But now we have so many effective interventions, each with their own pros and cons, of course.
It's like a toolbox full of different tools, and the urologist has to pick the right one for the job.
Exactly.
But wouldn't you say that MRI could be the most important tool, the one that helps guide all the other choices?
Oh, absolutely. MRI gives us so much detail, more than any other imaging modality. We can see the size of the prostate, but also where the blockage is, the type of BPH, the composition of the nodules, all sorts of things.
Like a roadmap of your prostate.
Exactly.
But even with all that information, there's
Yeah.
still that human element, right? It's a decision that the doctor and patient have to make together.
Absolutely. Technology is great, but we can't forget about communication and trust and understanding the patient's needs.
It's about giving patients options, explaining the risks and benefits so they can make an informed choice.
Exactly.
It's their body, their health.
Right.
And that's why it's so important for patients to be informed. Ask questions. Do their research.
I couldn't agree more.
We can't just sit back and let the doctor make all the decisions.
Right, you need to be involved.
So if you're listening and you're dealing with BPH, remember that you have options. Don't be afraid to ask questions. And don't settle for a treatment plan that doesn't feel right for you.
Exactly. There's no shame in getting help. And there's no one-size-fits-all solution. You need to find what works best for you.
Well said. That's it for our deep dive into BPH interventions. We covered a lot today.
We did.
From the basics of BPH to the latest in personalized treatment, we hope you learned a lot and that you feel more empowered to manage your prostate health.
That's our goal.
If you want to learn more, we encourage you to check out the resources we mentioned.
And as always, stay curious.
Thanks for listening.